Hey guys, I'm Dr. Jared Williams. I'm your third molar expert. And if you want to take your skills at next level, this is a channel for you. So today we're going to talk about what happens if I have a patient that has a paresthesia and the exact steps that you could take to either put pressure on your doctor or you as the doctor being able to follow the correct steps so that you don't get in trouble. And warning, warning, warning. If you're a GP who's not trained, this video will completely destroy your career. Just letting you know. All right. Let's jump into it. All right, guys. I'm Dr. Jared Williams. If you don't know anything about me, I am been practicing for 12 years. I have been completed over 12,000 cases, if not more. I'm a clinical assistant professor at the UT Health School of Dentistry in the graduate program, and I created this channel for GPs to take their skills at next level. The interesting thing is this: is that because I make the information so simple, patients have been understanding what they can do in order to understand their process of healing or what it should expect during their surgeries. So I come in peace, but you may not like peace if you have not studied to show yourself approved. All right. And so basically what I'm saying is this: if you're not well trained, if you're not trained within the field of third molar surgery, stop immediately. I can't tell you how many oral surgeons have pulled me aside or messaged me on social media and says, I don't like what you're doing. You're training GPs to do third molar surgery. Rah, 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 rah. I won't get into that in this video, but I want to let you know they're not happy because this is a $3 billion business, right? 3 billion with a B. And that's according to paperwork, papers 2016. We're in 2023, June. So I want to let you know that this is a no. This is a real deal, all right? And so if you find yourself in a scenario of wanting to do surgery and you're just going on social media, YouTube, or even Facebook and learning how to do these complex procedures and somebody gets screwed over, this video is going to show them exactly how to get you in trouble with the dental board, how they could sue you and get yourself in a lot of trouble. And the reason I'm saying this is not because I want to sell you any course. The reason I'm saying this is because I want you and your patients to smile after surgery. So I'm letting you know now, this is your opportunity to grow and get better. I would not want my family members to be seen by you or any of your friends and they're not trained to do these procedures, because that's why surgeons went to school for 4 to 6 years to get this training, or GPs paid to understand how to do these cases successfully. All right. So if you're offended by this video, that's your issue. That's not mine. All I want to do is make sure that dentistry on a whole gets better. So if your GP or your patient is getting better, then great. Because no oral surgeon, and I mean no oral surgeon, or docs like myself who get referred cases by GPs wants to be dealing with something that did not have to occur. All right. So hopefully you're not offended, but if you are, that's none of my business. Go get trained, take a residency, or there's some information at the bottom that you could take advantage of. So with that being stated, let's jump into the video.
Are you a GP tired of referring patients out of your practice and losing out on production? Did you know third molar surgery is a $3 billion industry? If you are ready, join the 5-day third molar surgery challenge, which will give you the confidence, knowledge, and skills to remove third molars safely. During this challenge, you'll enhance your surgical speed and gain exclusive access to insider secrets that specialists for years have tried to keep hidden. By learning these techniques, you'll be able to serve more patients, add more skills, and be the go-to doctor in your area. Don't miss this incredible opportunity to boost your skills, increase patient volume, and revolutionize your practice. Enroll now and let's embark on this exhilarating journey together.
All right. So I'm going to be looking down at my notes so that I could give you this content. If I get off base, just please forgive me. My wife is still working on me, right? She's still working on me. So pray for her. Pray for her. All right. So let's jump into it. So If you're a patient who is watching this video and you just recently had your surgery done and you're having some paresthesia or some altered sensation, burning, tingling, numbness, I want you to say this. If you're within about 1 week's time frame, please be at peace. All right, please be at peace. Number one, if I were to be giving points, I would say give your doctor and yourself time, right? Give your doctor time. If they've been faithful with doing surgery, understand that anything could happen. They could do everything perfectly and still get a bad result. All right. So I train GPs, train thousands of docs around the globe with these principles. They have wonderful results. And one of the main challenges that can happen is if when they do everything right and we still have a bad result. So, and when I say bad, it doesn't always mean that you're not going to have resolution of the problem. It's just like there is a problem that lasts longer, or there's something that happened that went contrary to what we expected. All right. We planned for it, but went contrary. And so I want you to say this. Number one, give your doc time, right? Let them manage your situation. If they are not, no, I'm going to do the positives. If they are receptive, they are having follow-ups with you, they are doing everything in their power to make you feel as if you're important, and they're walking with you, holding your hand metaphorically through your journey, give them some time. All right. I'm going to give you enough firepower that's going to get any doctor to get you to call you personally on their cell phone at the end of this video. So what I want for you to do is just give them time. One thing I'd love to say is this. One of the principles I follow is this: be quick to listen, slow to speak, and slow to anger. So if you're already pissed off at your doc and you're a weekend, I don't know what to tell you. I don't think any doc's going to be able to help you get to resolution if you're not being patient with the scenario. So I can't tell you, how patient you should be. All I could do is give you something. These three things: be quick to listen to your doctor, be slow to speak, really understand what they're trying to do, and be slow to anger. I promise you, if you follow that principle, not just in dentistry, but even at home, at work, you're going to end up having some wonderful results. All right. So point number one is give your doc some time. Number two is this: healing. All right. So you should only be concerned if your symptoms have not changed after 5 weeks, right? So the same symptoms that you're having, the burning, the tingling, the numbness, like the altered sensation when you rub it and something happens, then we should start having some challenges. But if that has not been, if you've been having some marked improvement, those are good signs. I want to let you know, nerves take the longest time in the body to actually end up healing. So if you understand that it takes the longest time in the body, then that should let you know, hey, I need to give myself some time. Nerve regeneration could take up to 9 months, right? There could be a surgery that was done in January 1st and it doesn't end up resolving completely until September of the year. And that's a long time, right? That's about the same time if a baby to be born, right? Egg and a sperm get together, it's in the right environment, the baby's going to be born. And that could take a long time. And, there's a lot of eating, there's a lot of speaking, there's a lot of meetings, there's a lot of talking, there's a lot of just putting your phone on your face, that adjustment, brushing your teeth, all these different things. I completely understand it. But I want to let you know that if you understand that it could potentially take up to 9 months for resolution, then I want you to understand that. But I don't want you to wait 9 months. I want you to understand that at that 5-week mark, if there isn't any improvement, then these are certain things that I want you to be aware of. So give yourself some time to heal. Give your body, right? Sometimes we think that we are detached from our body. No, we're fearfully and wonderfully made. And since we're fearfully and wonderfully made, your body's going to take some time. And my body, and your sister's body, your brother's body, your auntie's body, your friend's body, it's all completely different. And so if you understand that, hey, I have to give myself time to heal after the surgery that was needed, and it was all the pros, the cons, and alternatives was explained to me, and I said yes, I signed my name on the consents, I paid my money, I sat for the procedure, I was either asleep or awake, and everything's done, and I'm still having some challenges, and it hasn't been less than 5 weeks, has been more than 5 weeks, give yourself some time, all right? Because you never know, everything's still healing, all right? Number three, if you aren't given, let me see what it says here. Okay. If you're a doctor and I'm given ammunition for you all to get me if I end up having a lapse of judgment. If your doctor did not explain to you and give you enough time to understand what was going on, and they are giving you the runaround, they're not taking your phone calls, which I'm getting a phone call right now. If they aren't allowing you to come back for follow-ups on a weekly basis, it should be if it like at least twice a month at bare minimum. They're not letting you come back within twice a month. People still hit me up. So I got a meeting, got to run. So if they're still not letting you come in within like on either a weekly basis or bi-monthly basis, then we have some challenges. And once again, like you have that 5 week time frame. So typically when I tell my docs, when I'm training them on the JW method, how to do third molar surgery, I say I want them to be seen 1 week. All right. If something comes up, then call them and speak to them. Let them see you, even if it's a Zoom call, a video call, something, so that the patient can feel good. So if you're the patient and you don't feel comfortable and you haven't seen them either every week from your surgery or every 2 weeks from your surgery, we got an issue. You should not wait any longer than 2 weeks to be seen by your doc who did the actual surgery. And if they're giving you runaround time or the office manager giving you runaround time, this is when you get your pen and paper and it starts to get interesting. What I want for you to say is this. I want you to say these exact words. If you're speaking to the office manager, speaking to the doctor, you're probably going to speak to the office manager. You're going to say this, or the front desk staff. You're going to say, hi, I would like to come in to see Dr. XYZ. They're going to say, who's speaking? You're going to say your name. Then they're going to say, what's the issue? Or what's the challenge? You're going to say, I recently came in for procedure and it's been 2 weeks and I'm still having some challenges. We had the 1 week, but I'd like to come back in. If they say he's not available, she's not available, well then give it some time. Say, when is the doctor going to be available? If they say, well, we don't know, or it's going to be 2 more weeks or 3 more weeks or 3 more weeks, 4 more weeks, 5 more weeks, and say, okay, would it be a ridiculous idea if I went to another surgeon and if they said that there was damage that y'all caused, that I should speak to the dental board or retain a lawyer? If you say it in those words, that's going to get anybody that has a pulse or a heart or wants to keep their job their attention. And by saying that, you're probably going to get in a visit probably that day. All right. So I only want you to use these tools for good, right? We don't want to just be going out there causing trouble, because what goes around comes around. I believe some people call it karma, but I say this, you reap what you sow. So if you do bad things are going to come back to you. All right. So do that. And this is step number 3, right? In the event that you have to go down that path, and I pray to God, yes, I believe in God. Oh my goodness, I wouldn't be making these videos if I didn't. That's what it is. What it is. I hope to God that it doesn't get to that point. But if it does, then what you're going to do is this. You're going to go into Google and you're going to type in oral maxillofacial surgery, and you're going to type in micro neurovascular surgeon. And what you're going to do is this. You're going to contact the office. You're probably going to speak to the front desk staff. Front desk staff probably won't know what you're talking about, especially if you call a specialist like oral surgeon and they don't commonly do that procedure, because it is possible. There's levels to this, right? So if you contact the oral surgery office and they don't know what you're talking about, say, can I speak to the office manager to ask them about a current situation? After you say that, they're probably going to maybe come off a little defensive, trying to protect their doctor and say, hey, it wasn't your doctor who caused this. I just want to get some information, right? And so the information that you want to get is ask the office manager or even ask the surgeon, hey, when can I get a consultation? That's number 1. Number 2, typically, if I did need surgery to repair my nerve, let's just say it's completely severed, they need to go in there. What is the cost for a cadaver, so which means a dead person? What is the cost for a synthetic? What is the cost for if you have to go to me an autograph, which you have to go, not a signature, but an autograph, a graph that you take from yourself? And ask them the costs and the times of recovery and how long it would take for the procedure actually end up taking. Once you get that decision, then you could take that same information and speak to about three or so surgeons, microneurovascular surgeons, that actually do the procedure. Now, typically it's going to be out of pocket, so it's going to be a little expensive, and it's going to require you to have some pain and suffering because you got to go from one site to another to repair something that could probably didn't have to be taken care of. Now, if you're watching this surgery, if you're watching this video and you're like, I have my case coming up, I'm fearful as heck, and I don't want this case to be done. Well, I got a solution for you as well, right? And if you haven't smashed the like button or hit subscribe at this point, it's perfectly fine. The person who's watching this video at the same time you're watching it is going to do just that. So I don't need to worry about the likes and the subscribes, all right? But I'll take it because it lets me know, hey, the information I'm giving you is relevant. So what you're going to do is take that information and speak to 3 different doctors to get an idea of what they can do. And so you want to make sure that this is something that they routinely do on a consistent basis, because specialists, unfortunately, have to do the dirty work that other docs either couldn't do or just life happens, right? So for all those patients that are out there just like, hey, my case is coming up, what can I do? What about me? I don't have any paresthesia. I have a case that's coming up. What do I do? So this doesn't happen to me. Once you get to this point and your doc has given you the pros and cons and alternatives, they let you know the price and everything, ask them, if my nerve were to be disturbed, right, can you just do a coronectomy? Leave the roots in there and let it be. If they say yes, then great, go that route, right? Because once the crown's gone and there's no significant amount of infection that's currently at your tooth, then typically you're going to end up healing up nicely. So this is what you do and what you should be thinking about if and when you end up having some type of paresthesia. I gave you a 4-step ironclad system that a GP or you as a patient could use in order to facilitate your healing process and how you should be able to manage these patients. And I helped all those docs who are out there practicing without understanding that if they're not following the JW method, the patients are learning the JW method. Your colleagues are learning the JW method. And if you're left out in the rain, you're gonna get wet. And getting wet comes with a whole sequela of challenges. So there you have it, guys. I'm Dr. Jared Williams. I'm your 3rd molar expert, and I want you to remember, what looks hard is often easy. Make it a great one.